Hello, and welcome to the ProCE and Clinical Care Options Infectious Disease Podcast. I'm your host, Kim Neely. In this 3-episode series, Dr. Mary Bridgeman from the Ernest School of Pharmacy at Rutgers, State University of New Jersey, will share her insights on the burdens of RSV in older adults and risk factors of severe outcomes to consider in their care. To follow along with the accompanying slide set, please visit the link in the show notes for this episode. Now, let's get started and hear what Dr. Bridgeman has to say about appreciating the risks and burden of RSV in older adults.
Thank you so much, Kim. I appreciate it. And thank you to everyone for joining us today and taking time out of your schedule to attend to this important educational exercise. I'll be presenting a survey on the landscape and reflecting on the annual burden of RSV in older adults. I want to begin with a discussion of the burden of respiratory syncytial virus, or RSV, and influenza in older adults in the United States. RSV is a frequent and often unrecognized cause of respiratory infection in older adults and accounts for significant morbidity and mortality in this population. Estimates suggest that each year in the United States, RSV infections account for approximately 1.4 million outpatient visits, somewhere between 60,000 and 160,000 hospitalizations due to RSV infection and associated complications. And again, somewhere between 6,000 and 10,000 deaths that may be attributed to RSV infection, particularly concerning in our older adults. The burden of RSV infection is comparable to the burden of influenza in adults age 65 and older. I'll tell you, in most regions of the United States and in areas of similar climate, RSV infections tend to demonstrate a pattern of seasonal incidence. In the United States, the RSV season typically starts during the fall, somewhere between mid-September to mid-November, peaks in the winter, that's December to February, and persists into the early spring from mid-April to mid-May. Regionally, the southeastern U.S. and Hawaii may experience an earlier start to the RSV season and a longer duration comparative to other parts of the country, but I'll also come back to this point in a moment. The U.S. Centers for Disease Control and Prevention have surveillance data surrounding RSV season monitoring each year. And there have been shifts in the predictability of the RSV season start and the duration since the beginning of the COVID-19 pandemic. Due to the COVID-19 pandemic and some of the precautions that had been implemented in terms of social distancing, school closures, and masking and other interventions, really an atypical RSV seasonality had been observed. The CDC Health Alert Network issued a health advisory on September 5th of this year to indicate that really increases in RSV activity across the southeastern United States are being observed. And that's suggestive of shifting toward trends observed in RSV activity prior to the COVID-19 pandemic. I do want to take a step back just for a moment and review some of the basic principles of RSV infection and presentation. With regards to symptoms, adults with RSV infection usually have either no symptoms or mild cold-like symptoms that are consistent and can be seen with other acute respiratory tract infections. Rhinorrhea and sneezing are perhaps the most common, but also fatigue, headache, pharyngitis, and cough may be reported. Symptoms with RSV infection typically appear in stages and not necessarily all at once, and usually last somewhere between 5 to 7 days, but can linger for 1 to 2 weeks or longer, depending on an individual's underlying health status. RSV is transmitted through contact with infectious viral respiratory particles. And that includes contact with virus droplets from a cough or a sneeze from an infected individual, through direct contact with the virus, such as kissing or touching the face of an infectious child, or through inanimate objects and surface transmission. So contact with a doorknob, for example, or a counter surface where the virus exists, and then touching one's face before washing our hands. This is because RSV can survive for many hours on hard surfaces such as tables and crib rails. People who have RSV may become contagious a day or two before they actually present with symptoms and show signs of illness, and may remain contagious for 3 to 8 days while experiencing symptoms. Usually people become infected with RSV as infants and children. Essentially, all of us have likely contracted RSV, probably by the time we were just 2 years of age. We know that there are repeated infections that can occur throughout our lives, and really people of any age can become infected with RSV. I'll talk a little bit about how we can differentiate RSV and symptoms of RSV compared with other respiratory infections or conditions. Symptoms of RSV may commonly overlap with symptoms that are seen with other respiratory viruses and conditions, including cold and influenza, COVID-19, and even allergies and others. I do want to point out that RSV is not often associated with severe body aches or fatigue and fever, and even gastrointestinal complaints that are sometimes more commonly associated with influenza. Really, ocular symptoms are more characteristic of allergies and not a typical finding associated with RSV infection. We know a sore throat can be most bothersome for those individuals experiencing cold or COVID-19. So just to characterize and describe that, runny nose and wheezing can be more commonly associated with RSV. In terms of clinical manifestations, as mentioned, RSV is typically associated with mild, cold-like upper respiratory symptoms in adults who contract this viral illness. Severe RSV, on the other hand, is characterized by lower respiratory tract symptoms, including pneumonia and bronchiolitis, which may require hospitalization and really the need for oxygen and ventilatory support. RSV infection can lead to secondary bacterial pneumonias and worsening of other underlying health conditions, including asthma, chronic obstructive pulmonary disease, or COPD, and heart failure. We know that infants, young children, older adults, and individuals with immune compromise are at increased risk for severe RSV disease. Adults who are at highest risk for severe RSV infection include those individuals who've got certain underlying medical conditions. For example, those with chronic lung diseases like COPD and asthma, chronic cardiovascular diseases such as congestive heart failure and coronary artery disease, those experiencing immune compromise or with hematologic or neurologic comorbidities, or who have diabetes or chronic kidney disease. Additionally, older adults residing in nursing homes or long-term care facility settings, and those who are experiencing the frailty syndrome of aging may be predisposed or at increased risk for experiencing severe RSV disease. In terms of immune response may decline with age, the increase in the presence of those insidious respiratory illnesses and colds due to infection or reinfection, particularly concerning in our older adult population. I want to just spend a little bit of time reflecting on the findings of an analysis of medical claims data for RSV infection diagnoses identified using the U.S. Medicare 5% National Sample Administrative Database. Adult patients at least 18 years of age with at least one diagnostic code for RSV were identified using this claims database from 2011 through 2015. This study included 756 high-risk patients that had an average age of 77.1 years who were initially hospitalized with RSV diagnoses. Among these individuals, the authors observed hypertension, COPD, and high cholesterol to be the most prevalent observed medical conditions. Upon analysis, older adults, age greater than 85 was the observation, as well as those with COPD, congestive heart failure, hematologic malignancies, stroke, and chronic kidney disease were observed to be significant predictors of initial hospitalization for individuals with RSV infection diagnoses. Keep those conditions in mind, certainly, as potential concerns with regards to need for hospitalization. Evidence also suggests that our residents in long-term care facilities are additionally vulnerable to RSV infection. This was a prospective cohort study of 1,981 community dwelling adults aged 50 and older from Europe and age 65 and older residing in long-term care facilities in Europe and the US over 2 specific RSV seasons. With regards to overall incidence, individuals residing in long-term care experienced a higher overall incident rate and attack rate compared to individuals residing in the community. Just to point out, an attack rate, one of the outcomes utilized or analyzed in this study, is really just a variant of an incident rate applied to just a narrow defined population and observed over a more limited period of time, such as during an epidemic or an RSV season. I will just make a note that the CDC provides some considerations for how long-term care facilities can be prepared in addressing nosocomial or healthcare spread of RSV infection, including isolation and barrier precautions and recommendations for staff. I'll also recognize that some facilities may use droplet precautions as per local protocol. With regards to increasing age, we know that there is an increase in susceptibility and mortality to RSV-associated pneumonia. RSV infection is the 5th leading cause of community-acquired pneumonia requiring hospitalization. Notably, adults in the 75 and older age group had a reduced survival estimate even months after hospitalization for RSV infection or RSV-associated pneumonia when compared with adults 60 to 74-year-old age group. I'll conclude with some key takeaways that really, I think, remind us of the impact and consequences of RSV infection, particularly for our older adult population. I just want to reiterate that RSV is a common wintertime infectious disease that can be associated with significant morbidity and mortality for older adults. Adults who have certain comorbidities are likely to have exacerbations in the setting of RSV infection of those comorbidities, such as heart failure and COPD. It's estimated that RSV has some comparable data with regards to ICU admission rates and mortality for hospitalized patients, as can be seen with influenza infections. And we've really had a chance to explore the impact of advancing age with regards to susceptibility and mortality to RSV-associated pneumonia.
I'd like to thank Dr. Bridgeman for that excellent discussion, and thank you to our listeners for joining in. As a reminder, to view the slide set for this podcast and to access the full program on Frontiers in RSV Prevention for Older Adults, developments, recommendations, and the pharmacist's role, click on the link in the show notes for this episode. And please be sure to check back regularly for more episodes on important infectious diseases topics. Thank you.